To our top story tonight at 6, local health experts are sharing thoughts on the CDC's newest set of guidelines for COVID-19.
The biggest changes have to do with quarantine and isolation guidelines. 41NBC's Ariel Schiller explains what you need to know.
The CDC has changed its COVID guidelines again. Dr. Jennifer Hoffman, infectious disease physician with Piedmont MACON, says if you're exposed to COVID-19, you no longer have to quarantine. Instead, you should wear a high-quality mask for 10 days and get tested for COVID on day 5. There are different guidelines if you test positive for COVID, though.
Then they want you staying home for at least 5 days, and it can be longer depending on specific circumstances, and then wearing a high-quality mask in public until at least day 10.
Dr. Hoffman says, unfortunately, it seems like we'll be dealing with COVID indefinitely. She believes it's something we have to learn to live with.
Quarantine was very disruptive, for example, to school children, who were missing, 10 days several times a year, and that's just not good educationally for kids. It was bad for working parents who then have to stay home with their kids. So I think it was a variety of practical concerns. Is it ideal from an infection control standpoint? I mean, no, it's not.
Michael Hawkinson, Public Information Officer with the North Central Health District, says COVID cases are on the rise in Middle Georgia, but the district believes the numbers are underrepresented because of home COVID testing.
Because the home test is such a popular option, people can go to any kind of pharmacy, they can visit our local health department and get those home tests for free. But if they don't actually follow that up with a confirmatory PCR test, that's not a case that's counted.
Hawkinson says the concern with the CDC relaxing COVID guidelines is people think they can go back to normal. He says that's not the case and expects to see a higher level of transmission of the virus.
We want people to still be aware that to do that individual risk assessment, to make those decisions on a person-to-person basis, and just be aware that COVID is out there. It is very, very active right now. And we want people to stay safe.
Dr. Hoffman continues encouraging people to get vaccinated and boosted if they haven't already.
Vaccination is still very important. Getting boosters is still very important. It may not prevent you from getting COVID. In fact, it likely won't prevent you from getting the current variants, but it should help make your case much less severe.
In Macon, Ariel Schiller, 41 NBC News.
And the North Central Health District says a different COVID vaccine formulation is expected to come out in the fall.